What is an upper gastrointestinal or GI endoscopy? An upper GI endoscopy is a procedure using a flexible endoscope with a 1 cm diameter to see inside the upper GI tract. At one end of the endoscope is a magnifying lens, while the other is connected to a light generator that transmits an image to a monitor. The endoscope penetrates through the mouth, esophagus, stomach, and the duodenum, the first part of the small intestine. An upper GI endoscopy can detect abnormalities of the esophagus, stomach, and the duodenum. For example, inflammation, tumor, gastric reflux, bleeding in the upper GI tract, or constriction of these organs. Treat any diseases by penetrating equipment or other devices with an endoscope. For example, enlarging esophagus, injection, or tie inflated blood vessels in esophagus. An upper GI endoscopy can remove stuck objects, such as food, within the GI tract. A doctor can also remove abnormal tissue during an endoscopy without causing any pain to the patients. How to prepare for an upper GI endoscopy? Generally, eating or drinking is not allowed for 6 to 8 hours prior to the procedure. Patients should tell their doctor about all health conditions, such as heart and lung problems, diabetes, allergies, and all medications and dietary supplements that they are regularly taking. This should be done before making a decision for this treatment. Patients should abstain from any medications that affect blood clotting, including aspirin, blood thinners, blood pressure medications, diabetes medications, antidepressants, dietary supplements. Patients should not drive 12 to 24 hours after an upper GI endoscopy because they may still be affected by sedatives. Before treatment, patients should plan to have a friend or relative drive them home. How is an upper GI endoscopy performed? A doctor may have the patient gargle a liquid anesthetic or spray it on the back of the patient's throat. The anesthetic numbs the throat and calms the gag reflex during the endoscopy. An intravenous or IV needle containing a sedative is placed in a vein of the patient's arm. Sedatives help patients stay relaxed and comfortable. While patients are sedated, the doctor and medical staff will monitor vital signs, pulse, blood pressure, and oxygen level. The doctor gradually penetrates the endoscope into the esophagus, through the stomach, and down to the duodenum. Detailed images of the upper GI from a video camera displayed on a TV screen assists the doctor during the procedure. The doctor will then pump air through the endoscope to inflate the stomach and duodenum. This creates clearer images and allows for special tools that slide through the endoscope to help the doctor perform biopsies, stop bleeding, and remove abnormal growths. An upper GI endoscopy usually takes about 15 to 20 minutes. After the endoscopy, patients are moved to a recovery room, where they can wait for about an hour to allow the sedative to wear off. During this time, patients may feel bloated or nauseated. They may also have a sore throat, which can last for a day or less. Patients will likely feel tired and should plan to rest on the day without working out heavily. Patients will be directed when they can resume their normal diet and medications. Patients will be given the results of an upper GI endoscopy that same day. Biopsy results are usually ready within 1 to 3 days. The risks associated with an upper GI endoscopy include accidental puncture of the upper GI tract, esophagus, stomach, duodenum, including bleeding after biopsy. However, these risks are very rare. Patients who experience any of the following symptoms after an upper GI endoscopy should inform their doctor immediately: swallowing difficulties, sore throat, chest pain, and abdominal pain that worsens, vomiting, bloody stools, fever.